A new warning from the Food and Drug Administration about drugs President Donald Trump once held as game changers in the battle against COVID-19. Officials at the FDA warn against using hydroxychloroquine and chloroquine to treat COVID-19 outside of a hospital or approved clinical trial. The caution comes on the heels of the state's $800,000 order for hydroxychloroquine, a purchase Governor Herbert said he knew nothing about at Friday's news briefing.
I have some questions about how it came about, the transparency of it, and a few other things too.
ABC4 News obtained these documents that show the governor's Office of Management and Budget approved an order for 20,000 packs of hydroxychloroquine from Meds in Motion, a pharmaceutical supplier. In a statement sent to ABC4 News, Paul Edwards, communications director for the Utah COVID-19 Community Task Force, says in part, on March 31st, 2020, the governor's Office of Management and Budget approved the purchase of 20,000 units of hydroxychloroquine as a potential treatment option for COVID-19 from Meds in Motion at a cost of $800,000. The state has not yet taken delivery of that order. State Representative Suzanne Harrison, a medical doctor, says the state's large purchase of hydroxychloroquine is concerning.
The jury is out. We don't know if this is effective, and until we know something is definitively effective or helpful, that's an irresponsible use of taxpayer dollars, in my opinion.
According to the FDA, hydroxychloroquine and chloroquine have not been shown to be safe and effective for treating or preventing COVID-19. The FDA authorized their temporary use in clinical trials, but cautioned against using the drugs outside of a hospital setting due to risk of heart rhythm problems. As of right now, it's still unclear what will happen to the state's close to $1 million purchase of a drug that now carries an FDA warning.
That's part of the review process to see what the obligations are that we have, and did we get something that was not what we bargained for. So that's yet to be determined.
Representative Dr. Harrison said Utah never needed a large purchase of hydroxychloroquine to begin with because the state already has a stockpile of the drug.
There are already more than 170,000 doses of hydroxychloroquine in the state of Utah. There has never been a shortage of this medication in Utah. There is no supply chain issues. I think that's a red herring argument. I don't think this is really something that the state needs to get involved in.
Maybe we didn't make a mistake. We need to wait and see. So I'm just a little reluctant to say how we got involved because I don't know for sure, although I've heard different stories. Bottom line is we're not purchasing any more of this drug, hydroxychloroquine. And the situation in its entirety is now under review by our legal counsel to see what happened and how it happened and why it happened.
Reporting in Salt Lake County, I'm Brittany Johnson, ABC4 News.